My name is Dr. Yurkiw. I'm the chiropractor here in Kelowna, and today we're talking about gentle chiropractic techniques. And in the clinic, our goal is to move the spine into a better alignment so that the nerve flow can get through, and there's no pressure on that nerve root or even on the spinal cord inside. The way we do that is one of three ways in our clinic. One is a gentle adjustment using our hand to move the bone. Most people think it's painful, but what I say to my patients, it doesn't hurt any more than touching that spot. So when they first come in, I touch the spine. If that's a painful spot for them, the adjustment's not going to hurt any more than that. In fact, it'll feel better than that, moving that bone into a better place, taking the pressure off the nerve. There's other techniques too. An instrument like this called an activator is placed on the spine, and we move the bone using the activator into a better place. That technique takes the pressure off the spinal nerve roots and does the same thing. One more technique we use is tables. We do table adjustments to improve the alignment of the spine, and I'll demonstrate that in a minute. The last method that we use in our clinic is a drop table. And for the drop table, what we do is for the large parts, like the hips, we'll pop the table up like this, and wherever the bone's out of place, it could be the hip bone, the sacrum in the middle, or the spine, we're going to press down gently to make that adjustment to move the bone into a better place. So those three techniques are hands-on adjustments, the instrument to move the bone, and then the drop table to move the spine into a better spot. Sometimes patients ask me, well, why do we use a certain technique? And what I find in my clinic is I'll use a certain technique based on the patient's condition, based on how they're responding to the adjustments, as well as their age. Sometimes with an elderly patient, we'll use an instrument like this because the bones can be more brittle. So we don't want to use a drop technique with that. The table adjustments are used when people have problems in their hips or the lower part of their spine, and that technique works very well, especially when the bone's out of place to the back. We call it posterior, and we want to move it forward. With the person lying on the table face down, moving that bone by hand using the drop works very well. For my son, today he said, "Dad, my neck's out of place and my back's hurting. Can you do something for me?" And I did the two adjustments for him. That just happened to him. It was the way he slept, and he was going to soccer. He's 12 years old. And so to do the adjustments quickly by hand to move the bone in the lower part and in the neck area back into place was very easy and very effective. Today I wanted to talk about athletes and how we can help athletes. Last night we had friends over for dinner, and the lady was talking about the fact that she's very athletic, she does a lot of track, and she had pulled a muscle in the hip area called the glute medius. That's important. It's a shorter muscle, but it's still a significant muscle in the hip area. It goes between two bones, and that muscle, when it's pulled or shortened, it can affect the alignment of the hips and the body. As a chiropractor, we want to approach that from a structural perspective, meaning we want to check the alignment of the hips, we want to check the alignment of the bones, between the ilium, the sacrum, the lumbar, the spine, and the femur. And by checking that and doing adjustments, it'll allow the structure to be in the right place, which then allows the muscle to have the right length. So making sure that the spine's in place, the hips are adjusted, the lower part, sometimes people call it the tailbone, but the sacrum's in alignment, is very important because getting that all aligned allows the muscles that are going between the spine and the hips, between the hips and the leg bones, the femur, that they'll have the right length. And then getting the patient to do some stretches and exercises, putting some ice or heat depending on the situation, to get that muscle to recover quickly is very important. So the chiropractic approach for an athlete who's got a strained muscle is an adjustment to realign the structure and then give the body time to heal with proper rest, proper ice or heat, and proper exercises to get the body back to the way it was before. We've had a lot of people over the years in our clinic that have been into weightlifting and getting their body stronger. And I did that myself intensely for a period of time. And I wanted to give you some tips on that. Doing weights is good in that it strengthens the body and the bones. And you have to challenge your body. You actually have to push it beyond a certain limit in order for it to grow. So after a workout like that, you should be feeling a bit sore and a little bit inflamed, tender muscles, because of the weightlifting that you did. But improper posture and poor techniques can really cause the body to get injured. So if you overdo it in a poor position, if you're extending your spine and trying to lift something, it's going to cause compression of the bones in here, as well as it could cause some tearing of the discs or the muscles surrounding the spine or the ligaments holding the bones together. So if you get out of position or posture because you're straining your body really hard to lift that weight, although your muscles are going to get stronger in the area, you could do some damage to your spine, damage to the structure. So proper posture and technique are very important. And I'm hoping that we can do some videos down the road on proper lifting techniques and proper posture when you're doing weight-bearing activities like that. One particular exercise that I want to talk about is deadlifting. When you go to deadlift, you squat down in a certain position, and what happens then is you're going to lift that weight using your legs. And the focus has to be right on the legs and not necessarily on the spine. Once you get ready to lift the weight, your spine should be in a neutral type of position, meaning you should have your posture lined up and locked in that position. You're going to push with the buttock muscles, push with the quads in the front of the legs, and basically you want to focus on lifting that weight using your legs and not changing the alignment of your spine in any way. If you start to compromise by changing the alignment of your spine, kind of cheating, you could cause some damage to the discs, pinch a nerve, misalign a segment in the spine, and then that's going to require treatment to get that back into the right shape. So, and if you do pinch a nerve doing a certain activity, having a bone out of place, pinching a nerve causes damage to that nerve. It causes compression. The nerve will inflame and it'll start the healing process. You're going to feel pain. But if it's not dealt with properly, if that segment remains out of place and the compression remains on the spinal nerve, it can start to change the way the spinal nerve works. The nerve will start to become smaller. It'll start to change its fabric, its matrix. It's kind of like when you get an injury, your body will change and try and heal. And that's not good for it if it has compression over a long period of time. So you want to go see a chiropractor. You want to get that bone adjusted, get the pressure off that nerve, and that's going to allow the proper nerve flow to get through, and it's going to allow the nerve the proper room for the nerve to heal properly. It needs some space, it needs some time to heal, it needs the inflammation initially in order for that to go through its process of healing. But you definitely want to take care of it. You don't want to leave something like that for a long period of time. We've had patients over the years that have come in for a certain problem, like I had a lady that had a neck issue. She had poor alignment in her neck, and we were able to do the adjustments to correct the alignment of the neck. But I remember this one session she came in and she said she was washing some dishes, and the way she was lined up over the sink, she was kind of lined up forward in a crooked position. That caused a nerve to get pinched in her lower back. The good thing was she was scheduled for a regular session the next day. And so when she came in, she said, I'm wondering if you can do your regular session, adjust my neck, but can you also check my low back, because the low back is pinched and I was washing some dishes, and do you think you can help that? Well, I was able to check that, find out which bone was out of position, putting pressure on that nerve, and by doing the adjustment, it was actually quite easy because it had just happened. It was kind of a fresh injury. By adjusting the spine, taking the pressure off the nerve, realigning the spine, she felt better right away, but also the spine stayed in place, and she's been okay to this day.